Welcome back. So heart health may not be top of mind for teens and young adults, but by the time they turn 18, it's not uncommon to have already developed heart disease risk factors. So this being National Heart Month, we're also raising some awareness about heart disease and everything heart health related. And this morning, joining us from Kaiser Permanente is cardiologist Dr. Marjon Fariba. Thank you so much for joining us.
Of course, my pleasure.
And we were just talking during the commercial break, you know, young adults and teens, this is not something that stays top of mind.
It's not. You know, when we are young, we think we are indestructible. We can risk anything and we'll come out okay. And unfortunately, for the most part, that's true. You know, people are young and
a little bit more resilient.
And they recover a lot faster. And that's youth for you, which is wonderful. That's health for you. However, we need to also realize that heart disease doesn't happen overnight. You don't turn 50 and all of a sudden you have a heart attack. The risk factors have been building up and the plaque formation in your arteries have been happening. We know from autopsy studies that people as young as 15 and 20, they have already developed signs of coronary plaque formation. Not bad enough to cause a heart attack, but enough to cause a risk factors. And then today's diet and lifestyle is in such a way that these risk factors are climbing and developing in people. It's estimated by 2050 that a significant number of U.S. adults have coronary artery disease. Wow. That about 61% have coronary disease, about 31% suffer from heart attack, 18% have high blood pressure, and stroke is also on the rise. So these numbers are significantly higher than what they are now.
Right, and again, as you just touched on, these things don't happen just like that. Things sort of happen in a vacuum. So what are some of the key things that people can look out for? Because again, when it comes to heart health, it's not something that you can just check in on a daily basis. So what kind of signs should we be looking for?
So let me go back. So there are things that we can check in. There are some health measures that we can check in. So for example, your weight, your BMI. If you allow your BMI to be below 25, that's a healthier BMI for you. You know, your weight, managing your weight. Looking at your diet, increasing your greens and decreasing the fat intake and the fast food intake with the greasy food and the sugar combined together. Donuts, for example. I particularly like donuts, but how much of it can you eat and not affect your heart?
Yeah.
And also exercise. So those are some risk factors that we can check in and see how we are doing.
Sure.
At least 150 minutes of strenuous exercise per week.
Are there any other real red flags, though, that might be more obvious to somebody?
Family history. You know, when I see a patient who has, you know, a 40-year-old, 50-year-old who has coronary disease, I ask them, check in with your kids, make sure their cholesterol is good. Some risk factors, you know, familial hypercholesterolemia runs in the family. So if these teenagers with that significant family history, if they check their cholesterol and it's high, they can get started on medication at young age to prevent the heart attack when they're 50 or 40, like their parent.
You can basically project the future by observing the past, and that goes along with the family tree. Well, doctor, again, I know this is a topic that we can talk along for minutes on end, but unfortunately, we are out of time. But thank you so much for joining us this morning. We really appreciate you.
Absolutely, my pleasure. I do want to mention one more thing.
Go for it.
Mental health, depression, and anxiety also are risk factors for developing heart disease.
Okay.
So if the teenagers now learn how to become more resilient, how to control and manage these emotional reactions for themselves, they can do themselves a great help in the future. And now they enjoy life better, and they also prevent heart disease in the future.
And that's the hope. All right. Well, doctor, thank you again for all your time.
I appreciate it. Thank you very much.